So today what I'm going to do is kind of talk about a little bit of things that maybe you should prepare for prior to your appointment with me. So number one, definitely go ahead and have a list of any kind of questions or concerns that you have, because the reality is once we kind of get started talking during the appointment, you may forget those important things that you really wanted to address during your appointment. Number two is definitely bring a list of your medications or bring your medications with you to your appointment. Now, if you bring a list, what we need is the name of the medication, the dose or milligram of the medication, as well as how frequently you're taking the medication. And this includes all medications for any kind of medical condition that you're on or that you have. Because the reality is that there's certain medications that interact with others. There's also medications that can cause certain symptoms. And so it's really important to have an actual updated list of your medications to make sure that we're really verifying that there's no interaction or complications from medications that you may be on. The other thing is definitely to show up at least 15 minutes to 20 minutes before your appointment. The reality is with different medical conditions, there's different testing that we do that may take longer to get you prepared for your appointment. So sometimes we have to take different vital signs. So typically, most patients, we get their blood pressure and their heart rate when they come in. But there's some patients that may need further testing. So we have to lay them down and do blood pressure, stand them up and do blood pressures. Also, depending on the complications that you're having, we may have to do memory testing. And this memory testing can take up to 15 minutes to complete in the office. And so again, we want you to be able to have as much time for your actual appointment instead of having just all this time taken to be doing the things that we need to have extra information. Now, lastly, this is more of a comment to either caregivers or family members. So sometimes people don't want to say concerns or issues in front of the patient during their actual appointment, but it's really important for the doctor to know all of this information prior to making medical decisions that would be made at the end of the appointment. So if you have concerns, you can either call the doctor's office several days before and talk to the nurse and explain the issues that you're having so that the doctor can kind of look at those things beforehand. If you don't have time to call prior to the appointment, you can also bring in either a handwritten note or a typed out note that kind of lists your concerns or issues, and then give that to the nurse, and then the nurse would give it to the doctor prior to the appointment. So all of these things are really kind of just little tidbit information that would really make your appointment more successful.